Hello, I'm extremely delighted to invite you to the inaugural Black Healthcare Awards 2024.
The 2024 Black Healthcare Awards will be hosted by the Caribbean and African Health Network on Saturday, July 27th, the first of its kind in the UK. The event will focus solely on healthcare professionals of Black, Caribbean and African heritage. To learn more, we caught up with the chair of the Caribbean and African Health Network, Dr. Faye Ruddock, to discuss the importance of the awards, what's to be expected on the night, and more.
So my name's Dr. Faye Ruddock and I'm the founding chair of the Caribbean and African Health Network, an organisation that was established in 2017 in Greater Manchester, but is now a national organisation. I'm a clinician by background. I trained as a nurse years and years ago and became a public health specialist in university, and now I do lots of work across healthcare organisations. So CAHN was started on the back of a PhD that I was doing, which was all about health inequalities in the Black community. So it was very, very much around focusing on why Black people were having so many more poorer outcomes across heart disease, across certain cancers, across mental health, and wanting to understand what was going on. And CAHN was formed on the basis of what communities were telling me needed to happen, and the idea that they had no voice, no representation. So we started CAHN, and I say we started CAHN because CAHN was born from community. So communities formed the directorship for CAHN. So we had representation from faith communities, but also from community leaders, particularly, that were already working, doing things, but really struggling and really challenged. And so we came together, formed CAHN, and we've very, very much been an upstream organisation doing what we can do to detect health issues early, to get people health literate and empowered to be able to self-care and self-manage, and also to know how to have those conversations with your clinician, with your GPs, and not being told actually, what you're asking for is not reasonable, or so you know how to have those communications. And so we've been doing this now since for the last 7 years, and as I said, we're all about community, and the workforce is the community. So we are a very kind of holistic approach to actually addressing Black health.
You're launching the first ever Black Healthcare Awards this week on the 27th of July here in London. So can you talk to us a little bit about that event?
We are absolutely delighted to be hosting this event. It's really important to CAHN because we are about community, and communities form as well the healthcare services. So we know that our Black people are working in those communities. So we know, for example, in COVID, we know that we were affected. That was our communities that were affected more, that we as CAHN are looking after. So to have these awards is really important because it enables us to really highlight and spotlight the Black community in terms of what they're doing in our healthcare services. We know for the last 76 years, at least, they have contributed to building our NHS and building our health and care services. So to recognise them in this way is incredibly important and incredibly exciting, because we've had hundreds of nominations that have come through.
You mentioned obviously that you received a whole lot of nominations that you had to choose from, which would have been a very difficult task, I imagine. What was the nomination process like actually for this event?
So we started quite late with the nominations. So it was really around March, beginning of April, when we started the nominations process. So people could nominate themselves, or people would nominate other people to be put forward. And I said we had a lot. It started slow. It started to build up momentum. I see why People that do awards do give a leading time of about 8 months, just to really get everybody excited and nominating. So, but we did it, and we were really surprised to get hundreds of nominations. We involved independent people, judges, to score all the nominations. We had about 8 judges across the categories, judging and scoring these applications. We've got, I think it's something like 23 categories. We've tried to use our judges, our independent judges, not necessarily to score people because of the knowledge they have, say, in sickle cell. It wasn't about that. It was about the quality, and the energy and the passion behind people's applications that they want to convey, and that thing about, of course, the due diligence has to come into play. So we've had independent people looking at the due diligence, making sure, people are who they say they are. So we've had a real strict process of judging people going through, the actual nominations. And yeah, it's just delightful to see, those people that are listed there on the website that will be attending the awards or sending representatives to claim any awards that they may be getting. With that as well, it's about, people handing out these awards. Many of our patrons will be giving out awards. So we've also got awards in people's names. So where you have, for example, Professor Jacqueline Dunkley-Bent, she was the first chief midwife for the whole of England ever. She's the one that delivered Prince William's baby.
Oh, okay.
And she left her role last year, but she's now the first chief midwife, international chief midwife globally. And we have an award in her name, and she'll be handing out the Dunkley-Bent Award on the night. So we have, some of our patrons, such as those, same with Professor Dame Elizabeth Annuan. She was the first sickle cell nurse in the country, so we knew very little about sickle cell. Dame Elizabeth went abroad to understand and train, and she came back, and now we have lots of sickle cell specialist nurses, and she'll be handing out the Annuan Sickle Cell Nurse of the Year Award.
My name's Elizabeth, Professor Dame Elizabeth Annion, and I'm an Emeritus Professor of Nursing at the University of West London. These awards are very important to recognise the hard work and achievements of a significant section of the healthcare workforce. Having an award named after me is a bit surreal, quite surprising, but hugely honoured. Do you know what I'm really looking forward to on the night is meeting all of those people who are coming to the ceremony, and also being able to congratulate all the winners. So what I'd like to say to all the healthcare organisations involved is thank you very much for all the support you've given, but can you carry on giving that support? Because without it, it's very disheartening for staff to carry on providing the healthcare in the way that patients and families require.
So who are the sort of people that would be attending this? Obviously people within the healthcare profession, but would you encourage people outside of that as well to just come and celebrate with the healthcare workers and the community, as it were?
We want everybody. We want everybody to come and celebrate with us. Do you know, it's one of those things that we know, everybody knows, at some point in their life they will need healthcare. Everybody knows that.
Yeah.
So if you want to appreciate people, because you've probably been a recipient of some kind of healthcare, even thinking about babies born, it's kind of, getting your medicines, because we've got a pharmacy category, we've got a cardiology category, we've got respiratory, we've got allied health professionals, so we've got physios, and you name it, we've got dentists, we've got even people that do social media and influence through social media, getting health messages out. You know, we've got so many categories here where we know we've got Black talent, and people are serving not just the Black community, they're serving everybody. So what we're saying to people is, come and help us to celebrate this group, this section of the community that has given so much to healthcare over the last 76 plus years. And you could be a banker, you could be a journalist, you could be a scientist, you could be anything. We are encouraging, people from all walks of life, that can see a reason to celebrate, a section of this community. Then please do come along and support us.
Excellent. And so how can people actually get the tickets for this event?
So the tickets are available in so many different formats. So you can go onto the website, or you can contact us. There's a number on there to contact us, but there's also an email on there if you want to contact us to get a ticket. So lots of different ways. We'll get you, ticketed. We'll get your meal options. We'll get you ready to kind of like to join us on Saturday.
Awesome. And what are the people who are getting these tickets and coming going to be expecting from the night? Obviously, you're going to be giving out awards, but what else do we have in store? Any surprises? I assume people are going to be telling their stories, because obviously you've mentioned some really important figures within the healthcare community. So what can people expect from that?
It's just going to be fantastic. It's going to be a night of, yes, awards, because that's what we're really there. That is the key thing. But wrapped around the awards is lots of entertainment. So if it's just talk with the entertainment, we will have cultural entertainment. So we'll have, African drummers, we'll have acrobats. I've seen some amazing performances that they've done. So the African Afrobats will be performing. Acrobats, sorry. We will also have a saxophonist as well. So when you're eating, you'll be entertained by, a saxophonist, which is incredible. We've got speeches as well to inspire not just the people that are already in healthcare, but those that are thinking about coming into healthcare. So we've got students. There's a category which is for students, Black Student of the Year. So again, so we've got those people in there. It's that thing where you look for role models, isn't it? And you look
exactly.
And so we've purposely said we want to have young people in the space. It's like a pipeline of progression that you see. So you want the young people to see, about the possibilities, and you want to also enable them to network and to be able to see the people in the room that could actually probably help them in their journey, whichever journey they're taking.
Yeah,
it's a place, where there's so much to be gained, so many benefits. Not only having great food, it's not Caribbean or African food, but it's going to be great food, and we will, around that, we will be, having a great time. So yeah.
Excellent. This sounds really exciting, and I actually encourage people to try and get those tickets and attend the event. I personally will be there on Saturday, and I can't wait. I look forward to seeing what is going to happen, and the glitz and the glams and all the accolades. It's going to be very interesting, and well done to you guys and your team for putting this together in the way that you have. And obviously this is the first year, but then I assume next year there will be another awards ceremony as well.
Absolutely. Yes. This is an annual occasion, an annual event. So we've got the date for next year. So please, if you are really not able to get here on Saturday, please do put it in your diary. The 19th of July 2025, we will be in London having another event. So please do. And we are selling tickets right up until Friday. So please do, seek us out right up until the very end.
Excellent. Thank you so much for your time, and look forward to attending the event on Saturday.
Looking forward to seeing you, and thank you very much for your time. Thank you.
It will be amazing to see you at these awards. Get your tickets, get friends and family, grab a table, and come, let's celebrate this incredible contribution of Black, Caribbean and African healthcare professionals right across the country. Saturday, The 27th of July, 2024 is the date you cannot afford to miss. Thank you.